But let's go back in time a little bit, sir. Let's trace the history of ECT so that our viewers get an idea about how it was earlier and how it has evolved to become much and more safer as we have moved ahead in time, sir.
ECT was the first effective treatment for any psychiatric illnesses other than maybe psychotherapy. Medicines came about 2.5 decades after the ECT was invented.
We have administered ECT to a pregnant woman, and how much more evidence do you need that it is a safe treatment?
Right.
So it is 2 lives in question and still ECT is safe.
If you test people's memory before ECT and 3 days after ECT, the memory problem will be more 3 days after the ECT. But if you test the same memory after 15 days, it will be better than even the pre-ECT state.
Oh wow.
Some people come to us saying that I have this bad memory which I want to forget. Can you give ECT and make me forget? We are sorry, we can't make that happen.
Yeah. Let's throw some light on how ECT actually works.
That's $1 million question. If I find that out, I'll make it a Nobel Prize.
Hello friends, welcome to the 7th episode of Mental Health with Dr. Harkishan Mamtani. All throughout this journey of mine, I've been very heartened and emotional to see the wonderful response from you all. I've been encouraged more and more to get such wonderful guests on these episodes so that the conversations around mental health keep going. The last time we spoke to Dr. Vinky Rughwani sir on the aspects of mental health related to sickle cell and thalassemia. If you have missed out that episode, do check it out. This time around, we decided to speak to Prof Jagadisha Thirthalli, who is the head of Department of Psychiatry at NIMHANS, Bangalore. This episode is very important for me, not just professionally, but also personally, because Prof Jagadisha happens to be one of my teachers at NIMHANS. I continue to learn from him, and I thought it would be a great moment for us to hear 2 cents of wisdom from him on this episode. He's an avid researcher having hundreds of publications in international journals. One of his key areas of research interest is ECT, that is Electroconvulsive Therapy. Now, all of us have a very difficult or a different perception for ECT. People think that it is given only to very aggressive patients, or it's like an end result of a severe mental illness where nothing else is possible. And the perception is that, it's like a barbaric treatment where the person's hair get raised. It's like a form of punishment. But all of these myths, are they actually true? So we decided that let's bust all those myths centered around this highly successful treatment in psychiatry. Let's see what Professor Jagadisha had to say about ECT, and let's see what are the myths that he has busted. For more such mental health related content, do subscribe to my YouTube channel and don't forget to press the bell icon. Thank you. Hello, sir.
Hi.
It is a moment of great privilege to have you here in Nagpur, and more than that, on my show, Mental Health with Dr. Harkishan Mamtani. Thank you so much for agreeing to do this on a very short notice, sir.
It's my privilege to be in Nagpur and in your podcast.
And thank you, sir. So, the topic that we've chosen today on electroconvulsive therapy, that is ECT, the earliest discussion about ECT that I remember having with someone was one of my friends during my MBBS years, final MBBS, I still remember. And he was very apprehensive about one of his uncles who was advised ECT by his psychiatrist. And he was in 2 minds whether he should go ahead with it, having heard things like this is a very brutal form of treatment. It is like a terminal form of treatment. No other option left. Hazardous for health, hazardous for your memory. So many notions that he had at that time, which made me even think that why does such a treatment even exist? Now that I look back at that almost 5 years, 6 years down the line, I've done my psychiatry residency, given ECT extensively, I realize how misinformed people are about ECT. So it's really great that, we are doing this podcast with you today, sir. What do you think is people's reaction? What is the most common reaction that people have when you suggest that they should go ahead with ECT as their next treatment option?
Look, it depends on what kind of people that we offer it to and how we offer it.
Right.
So, there are many terms for ECT in common parlance.
Right.
Many people very loosely call it a shock treatment, and some people call it as ECT and then explain electroconvulsive therapy.
Right.
And some people just say current treatment. Some people use a peculiar term called brief pulse brain stimulation. So people will not even know that they are talking about ECT.
Right.
I had seen one nurse who had worked in one of the psychiatric hospitals. When I asked her about ECT, she didn't. She said, "I don't know about ECT." Then I described to her the procedure. Then, oh, it is brief pulse therapy.
Oh.
So it is like that. So how you offer it to people, people take it differently.
Correct.
Depending on how they offer.
Right.
So, I mean, once people understand that we are giving some electrical stimulus to the brain and then it produces a seizure and that's the treatment, people sometimes react very apprehensively as you would have done in your younger days.
Yeah.
And many people say, okay, if that is the case, we don't need it. We don't want it. But to be fair, there are a bunch of people who are very open to it. And if they say that, I mean, I think they have, it also depends on the trust on the doctor. If they trust the doctor, they would simply say, if doctor, in your opinion, we should give that, I am okay with it. So I think there is, I cannot pinpoint one reaction to be very common. It depends on, I think it also depends on if a less trained doctor communicates versus a veteran communicates with the patient.
Yeah.
So it's like that.
Right. So it's very variable, like you rightly said. But I think even in educated gentry, I mean, the educated masses also, I believe there's a lot of misinformation. So I was a medical student back then when this question was posed to me. So even I was not aware of the nitty-gritties of ECT, how it works. What do you think is the reason behind these misconceptions or stigma with ECT, sir?
Yeah. Look, I mean, as a concept, if you think somebody is going to give electrical current to the brain, it looks very crude. It looks very something like, is it even done? That kind of reaction, it is natural for people to have it. And if people have never read anything scientifically about it, they may even be scared as to what may happen. Added to that is a lot of misinformation that is there in movies, in some novels, and in social media. So there are many myths about ECT, that it's very painful, that it's a form of torture, that is given to punish the person who is behaving abnormally, that it erases the memory.
Right.
Interestingly, some people come to us saying that I have this bad memory which I want to forget. Can you give ECT and make me forget? We are sorry, we can't make that happen. Right. So I think over time it has generated some degree of bad press, I would say. I think many people who have not given a serious reading into it may believe that it is not a good treatment. But anybody who has studied reliable sources, read reliable sources, like for example, American Psychiatric Association or Royal College of Psychiatrists guidelines, Australia and New Zealand college, guidelines. All of them endorse ECT. If it was so bad, why is it so prevalent in advanced countries like that? So, unfortunately, it has gotten a bad name, and it's our duty to kind of remove that bad name from the ECT. Yeah.
Right. You spoke of guidelines from the West, from Australia, but I also am aware that the Indian Psychiatric Society guidelines for ECT, you yourself are an author for the clinical practice guidelines. So
Yes.
you've also widely advocated the use of it. And I totally agree. I mean, the kind of improvement that I've seen in so many patients, ECT should be used. And let's hope that this podcast serves as a message to everyone who's, a little worried about whether their relatives or they themselves should undergo this treatment of ECT. But let's go back in time a little bit, sir. Let's trace the history of ECT so that our viewers get an idea about how it was earlier and how it has evolved to become and more safer as we have moved ahead in time, sir. So if you could just throw
Yeah, I think it has a fascinating history.
Right. Yeah.
So viewers are aware of what are called as seizures, fits.
Correct. Yeah.
So many medical professionals had noticed that people who had both mental illness and seizures tended to behave better whenever they had a seizure.
Right. Yes.
So when they had a seizure-free time,
Right.
that was the time their mental illness used to be more,
Yeah.
and they used to behave very abnormally.
Right.
And then seizure comes, and their symptoms would improve.
Right.
People had carefully observed this.
Then
Then some people thought, why can't we induce seizures to treat mental illness?
Correct.
So initially they didn't know how to do it. So they started giving some chemicals like camphor, metrazole, some of those things. They were able to successfully induce seizures and also to help some people with mental illness with that. The problem with such medications was that the seizures were unpredictable, and they have to inject the medication and wait almost for several minutes and sometimes hours, anxiously looking at now it will come, now it will come, now it will come. So it was not predictable, and it was also very unpleasant for the person who receives it.
Right.
Then they thought, can we do something else to make it more predictable and more controlled?
Right.
So that is when Serenity and Binney. So they thought of using electricity to treat people with mental illness. So I think in 1937 they used it for the first time, and the first patient that they gave ECT to improved dramatically. He was a person who was wandering in the streets, not knowing what he was talking. He was a very disheveled person, and those days there were no treatments for such people. And when these people, then Serenity and Binney treated him with ECT, he improved very well, and after 3 or 4 ECT sessions, he became nearly normal. So that kind of made big news among the people with psychiatric illnesses and doctors who treated them. And that's how ECT became very popular. But initial days, they used to simply use electricity to induce seizures, and the seizures were very violent. Convulsions were very violent, and it was unsightly to look at. It looked barbaric. Part of the bad name for ECT has come from the original views about how ECT was given. But soon enough, people found out that we can give muscle relaxants. So you can give an injection which makes the body very relaxed, and then if you induce seizure, there is hardly any convulsions, but the person actually gets better. He has a seizure, but it will not be noticed on the body. And but the problem with that approach is that when you inject muscle relaxant and the person is conscious, it's a hellish experience. It's a very scary experience. So what they do is, initially we sedate the person with an anesthetic agent. The person goes to sleep, and then muscle relaxant is injected. That makes the person first sleep, and then muscles are relaxed. then electricity is given. There will be hardly a few movements of the body, and then after about 10-15 minutes, he becomes better. So that was a turning point. It made ECT practice very humane. It happened way back in the 1950s. Then what happened around the same time? Many antipsychotics, antidepressants, many medications started coming. So ECT was the first effective treatment for any psychiatric illnesses other than maybe psychotherapy. Medicines came about 2.5 decades after the ECT was invented.
Right.
But once the medicines came, the popularity of ECT went down. So people found that, I think it was good that medicines came and ECT went down because ECT's effects are temporary. The person gets better for a few weeks or months, and then he will require it again. So once the medicines came, the need for ECT came down, which is, I think, a good development. But people started noticing that people who do not respond to medications may still require ECT. That's how the ECT kind of survived a lean patch, and then people started finding out that for people who require rapid improvement, people who are highly suicidal, etc., it works wonders. So it has made a comeback of sorts, and it has become again relatively popular. So that is a checkered history of ECT.
Very,
very, very brief.
Brief indeed, but I think you very beautifully summarized how it began, what was the principle on which it was based, and after that, like you told, how it has become increasingly safer with the use of anesthesia and the muscle relaxants. It has become a lot safer. We call it MECT, modified ECT.
Correct.
And it is very important for the viewers to know, sir, how long the anesthesia lasts, because there are a lot of myths about that as well. So if you could tell us about that as well.
Sure. So ECT procedure lasts for about half an hour to 45 minutes. So initially the anesthetist evaluates, the nurses evaluate, and then the anesthetist evaluates the person, and then the first thing that we do is to give an anesthetic agent which makes the person sleep. We keep talking to the person and we make sure that he is into good sleep. Then is the time then we give the muscle relaxant. When you give muscle relaxant, in about 2-3 minutes the person becomes very relaxed. Then the ECT, the electrical stimulus, is given to the head. That induces seizures for about 30 to about 60-70 seconds. Then after about 10 minutes the person comes out of anesthesia. By about half an hour or so he becomes completely alert and he is able to walk back. So the entire process takes about 30 to 40 minutes.
Right. But it's very important to know for our viewers as well that the anesthesia is not very long lasting. It's just for around 10 minutes. Yeah. Even the seizures, which people are very scared of, it's hardly less than a minute. So it's something which is, we should not freak out about that. That's important. What would you say about the strength of the current that is given, sir? That is another common misconception or doubt in the people's minds, sir.
You mean how much of electricity is used?
Correct, yeah.
It's very difficult to say, but for general public, it suffices it to say that the electricity that may be required to light about an 80-watt bulb for about 2 seconds.
Right.
That's how much electricity is required.
And that's very small then.
That's small. Whether it's big or small, let the viewers decide. Listeners decide. But I'm giving you an objective.
Right. No, that's rightly said. The quantity of current is not too much that people should freak out. The whole motto behind asking that was this. But you spoke about how ECT helps in individuals who are suicidal, and I've seen remarkable improvement in suicidal patients with ECT. What are some of the other places where ECT can be used? Which disorders you think you've had good experience?
Right. So I'll start with suicidality itself.
Right.
It does not work for all people who are suicidal. So when suicide thoughts come to a person in the context of a mood disorder, in the context of severe depression, in the context of schizophrenia,
right.
In such situations only ECT will work.
Right.
there are people who become suicidal as a result of some personality disorders or as part of some acute stress that has happened. But the person has not actually developed a mental illness, so to say. Like, for example, somebody has undergone a grief and he says, I also should go with him. In such cases, I don't think ECT is useful or should be given. It is in the context of medical illnesses called depression, medical illnesses called schizophrenia, and that leads to suicidality. It works wonders in such cases. So, apart from people who are highly suicidal, it is also given to people who have a peculiar condition called catatonia. So, catatonia, when a person experiences catatonia, he becomes or he or she becomes mute. They don't talk much. They sometimes hold the same postures for minutes and hours, or sometimes even days. They don't eat. They don't attend to their nature calls, and they sometimes they wouldn't budge from their bed at all. ECT kind of melts catatonia. It is very useful in catatonia. And ECT is also useful when people become extremely aggressive, extremely agitated due to a mood disorder or a psychotic disorder. It is also useful when people do not respond to traditional ways of treating depression, like medications don't work, one medication, two medication, three medication, antidepressants, they don't work, psychotherapy doesn't work, or in people with psychosis, antipsychotics do not work. There is a very good antipsychotic, clozapine, you will know that it doesn't work. In such patients, we see that ECT has some role, and it seems to work in such people also when nothing else works. So there are such many. You said ECT should be more used. I would put it in a slightly different way. ECT is useful only when it is used in specific conditions. So it is not like one size fits all kind of a treatment. It doesn't work in many conditions. It works wonders when it is carefully, patients are carefully picked and carefully chosen for ECT. In such patients, it works.
So you spoke about how ECT works well for suicidality in the context of certain psychiatric disorders, aggression, catatonia, and treatment resistance, essentially. But treatment resistance is one place where, people have this misconception that ECT is the last resort for treatment. When nothing works, then you have to go to ECT. But like you already described, for suicidality or suicidality in the context of psychiatric disorders, like you said, or very severe aggression or catatonia, ECT can also be considered as a first-line treatment?
Yes, it is. It can be first line in many other situations also. Good that you asked that question. Pregnant women, for example.
Oh, yes, yeah.
Pregnant women in their first trimester, people hesitate. Rightly so, people hesitate to give medications because it may have impact on the fetus. So, in such cases, ECT can be used as a first-line treatment because it does not have the adverse effects that the medications have. People may be surprised that we give ECT to pregnant women, but it's a very safe treatment in pregnant women, safer than the medications many has. The other thing, if I say people may be surprised, is the fact that it is very useful elderly people. Elderly people with severe depression, elderly people with dementia, with severe behavioral problems, they can't tolerate medicines like young people do. So people who treat them get really worked up because the medicines that they use in young people cannot be given to people and at the dose that the elderly people can tolerate. So in such cases also ECT can be very useful to as a first line or even a second line treatment. So I think it should not be in our minds that ECT is the last resort.
Right.
It is in some cases.
Hmm.
It is in some
Hmm.
cases the last resort,
Hmm.
but in many cases it is not.
Right.
In many cases it can be the first line or even the second line treatment.
Right, sir. And you spoke of pregnancy, sir. When I explain to patients about ECT, this is one sentence which I've used very commonly, that we have administered ECT to a pregnant woman, and how much more evidence do you need that it is a safe treatment?
Correct.
So it is 2 lives in question, and still ECT is safe. So
Yes.
very rightly said, sir.
Yes.
You spoke of certain special populations, which brings me to that point: pregnancy, geriatric, or elderly people. What do you think about the use of ECT in children, sir?
Children, it's very useful, but I must say that there are not much rigorously done studies
Right.
in children.
Hmm.
In NIMHANS and all over the world, thousands of children receive ECT, and we have documented that most of them or all of them do very well.
Right.
We have not observed any adverse effects in children. But being from a premier institute, I must give the caveat that controlled trials have not happened in children as they have happened in adults.
Right.
So it is like there is good experience-based evidence
Right.
that it is very safe in children. Again, when children are selected carefully with specific conditions.
Right. No, because even Mental Health Care Act 2017 also does not debar us from giving ECTs to children with some special conditions. But anyway, sir, but you spoke of giving ECTs to these kind of vulnerable people, pregnant women, elderly, children. What special precautions do you think need to be taken or are taken by a psychiatrist while giving ECT in these populations?
Look, the most important thing that we should do is to give the patients and their caregivers a choice.
Right.
That goes miles in terms of winning their confidence and not forcing anybody into the treatment. Would give them some autonomy, the sense that they are part of a decision to receive the ECT. So that is the first thing that we should all have in mind when discussing ECT with the prospective patients who will receive it.
Right.
Having said that, people also should know that once a person is selected for ECT, the person goes through thorough psychiatric evaluation, thorough physical evaluation, all the investigations, lab tests are done. If needed, brain imaging is also done, and anesthetists come and see the person.
They give a clearance.
They have to. I mean, they are very thorough in their examination. So a lot of precautions are already taken as routine care for people with people who receive ECT.
Right.
So once they are taken, we may classify a certain number of people, particularly those who have cardiac illness, who have some respiratory illness, as high risk patient.
Right.
Many people may not know this. It is not there in the popular mind that the problem with ECT is not so much about the brain; it's about the heart.
Yeah.
So when ECT is given, seizures are generated. There is a increase in the heart rate. There is increase in the blood pressure for very brief period, about 1.5 minutes or 2 minutes. The heart rate and blood pressure will go up. If a person has had a cardiac problem or some respiratory problem, such patients may have higher chance of some cardiac problem coming up. But if we work along with a cardiologist or a physician and close liaison with the anesthetist, people who have had myocardial infarction, heart attack about a week back have also received ECT safely. So with a lot of precautions taken, ECT is safe.
Is very safe. Yeah. Which brings me to a very important question, sir. ECT is safe everywhere. We talk of indications in medicine, but there are also contraindications. So, are there any places or conditions where you would not advocate the use of ECT, sir?
Not as such. I mean,
Mm.
in our parlance, there are no absolute contraindication for
Right.
ECT.
Yeah.
There are precautions. There are relative contraindication.
Right.
As I said, people with cardiac illness,
Mm.
people who have compromised cardiorespiratory system,
Right.
very uncontrolled diabetes, uncontrolled hypertension,
Or intracranial tension,
intracranial tension. I mean, brain tumors,
right.
big brain tumors.
Mm.
Small tumors, we can still go ahead.
Right.
Right. I mean, not all tumors cause raise in the intracranial tension. So,
Right. Yeah.
these are some of the places. And
Mm.
if a person is prone for any memory deficit,
Mm.
in such cases, we may not prefer ECT. We may prefer something else.
Right. Right. And I think it's very important that you mentioned that, sir. Which brings me to a very important question, sir. There's a lot of hue and cry about memory disturbances with ECT. Can you throw some light on that, sir? Is it actually that bad how people portray it, or you think it's transient?
Memory problems do occur
Yeah.
with ECT,
Mm.
but as you put it, it is transient.
Mm.
I would be misleading the audience if I say that there are no memory problems with ECT.
Yeah.
There are.
Right.
But commonly what happens is that if a patient receives ECT, especially 2, 3, 4, 5 ECTs, then if you ask the person about what happened yesterday, etc., they may have some confusion in recalling that.
Mm.
Their memory can be a little hazy.
Mm.
They are not as sharp as they were before ECT in answering some of the questions,
Right.
especially the recent one memory.
Right.
The old memories they still remember very well.
Hmm.
The recent memories they may forget.
Hmm.
But the good thing is that after we stop ECT, if we give not even about a week or 2 weeks,
Hmm.
the memory comes back.
Right.
So their memory starts becoming better and better.
Hmm.
So there is one interesting meta-analysis done by scientists in Ireland, which has shown that if you test people's memory before ECT and 3 days after ECT, the memory problem will be more 3 days after the ECT. But if you test the same memory after 15 days, it will be better than even the pre-ECT state.
Oh wow.
So
Okay.
that it doesn't mean that ECT improves memory.
Yeah.
What it does is that before ECT, the person has a psychiatric illness.
Yeah.
Because of psychiatric illness, there are some cognitive difficulties.
Yeah.
ECT takes care of that, and the person's memory actually improves.
Yeah.
So that is something that people should know.
Exactly.
So there are occasional people who say that 1 or 2 instances of their life they are unable to recall.
Hmm.
People have said this about a month, 2 months later, or sometimes 1 year later also.
Hmm.
But they are very small islands of memory loss that they may have. But most of them say that I don't remember this, but thank you for giving me ECT, but because I am much better now.
So does not matter. Yeah.
It doesn't matter. So I have forgotten that it's okay.
Right.
So there is another interesting thing. I mean, whenever people improve with ECT, they report a lot of improvement in their memory.
Hmm.
It is those people who do not respond to ECT, whose depression continues.
Hmm.
They are the ones who experience memory deficits.
Hmm.
It is very hard for us to tease out whether the depression is causing the memory deficit or the ECT added to it.
Hmm. Hmm.
They tend to say that ECT did this to us, but there is no objective method of proving that ECT caused that.
Right.
So, but most people, I mean, almost all people who improve with ECT
Hmm.
actually report much less cognitive problems.
Right. Right. Very important that you highlighted this, sir. But any other side effects that someone who is going to decide about ECT should be aware of, that these can happen with ECT?
I mean, there are very common side effects like headache,
Hmm.
body ache.
Hmm.
Some people feel kind of nauseous. Some of these are actually due to anesthesia, not necessarily due to ECT.
Hmm.
And sometimes people, I mean, if the muscle relaxant that we give are they relax the entire body, but the ECT is given somewhere here in this part of the scalp. The muscle there gets a direct current.
Hmm.
It causes clenching of teeth,
Right.
and we give protection so that the teeth should be protected. Sometimes then if there is any problem, people may have some bleeding in the mouth.
Right.
So these are some of the side effects.
Some side effects. But none of these actually should be something which we should be very worried about, right, sir?
I think so, yes.
Right. Yeah. So let's address a very important question, sir. And I mean, you've done extensive research on electroconvulsive therapy. You're probably one of the key people in India doing so much research on ECT. But for a layperson who is listening to this podcast, who is watching us, we let's throw some light on how ECT actually works.
That's $1 million question. If I find that out, I may get a Nobel Prize. So, we don't know how it works.
Right.
Interestingly, you know that depression and mania are two different poles of the same illness. In depression, people are extremely sad.
Yeah.
They are despondent. They have a lot of negative thoughts. Whereas in mania, they are very happy and they are very confident. They get new ideas, etc.
Yeah.
ECT works for both.
Right.
So
Yeah.
if there was a biology that explained depression, that explained mania, ECT kind of reverses that.
Right.
And traditionally, we have been taught that mood disorders and psychotic disorders they have different biology. ECT works for both.
Yeah.
So it is very confusing because it works for many conditions.
Yeah.
Having said that, we do observe some changes in the brain which may be responsible for both its effects and side effects. For example, the memory gets kind of processed in our brain in an area called hippocampus. That shows some changes. I mean, there are some, the size of the hippocampi increases with ECT. There are small areas where we process emotions called amygdala. The size of the amygdala varies after ECT. There are places where we have some social cognitions called insula. There are changes in that areas. So there are multiple areas of the brain which shows some changes in their structure and function with ECT. And there are many neurochemical changes that are observed. There is one neurochemical called GABA. GABA is an inhibitory neurochemical. You may say that it's a kind of a calming neurotransmitter. So increase of GABA has been observed to be related to the improvement people perceive with ECT. So and it also causes a lot of changes in the hormones. You would have heard about the stress hormone called cortisol. So people have noticed that the body's response to stress, which causes increase in cortisol, decreases with ECT. That means even if there is a stress, the cortisol will not increase. So some research, a lot of research has shown these kind of findings. But how exactly these lead to a person's improvement is less well known.
Still, I really like the fact that you are very honest in admitting this, that even though we spoke at length about how effective or how useful ECT can be, but we still don't know how exactly it is working.
Look, all of us know how to use mobile phones.
Yeah.
Do we know how it works? So it is pretty, works in a lot of people.
Right.
Unfortunately, we don't know how it works.
Right, sir. But one question that I had in my mind, sir. In the beginning, you said that ECT, the effects of ECT are short-lasting. But a lot of these structural changes, chemical changes that you mentioned, do you think that these changes sustain the stand of time, like they are long lasting?
There are a few research papers which have looked at that. Look, in older days, before the medicines came, only ECT was there. So when ECT was compared with no ECT, people who received ECT improved. Other people, a few of them also improved, and then when they got discharged, people who received ECT relapsed much later than people who did not receive ECT, which or many of them didn't even relapse. A few of them, we understand that might have ECT might have caused some changes to the extent that the course of the illness has changed. But I don't think there is enough research for us to believe that ECT has long-term effects. We should understand that ECT is a fairly short-term treatment. Its effects last for a few weeks or a few months. But as I mean, like any other treatment, any treatment in psychiatry, if you stop, the symptoms will come back.
Yeah.
So is it ECT. So ECT is given in the background of medication, psychotherapy, family therapy, so very other psychosocial interventions. If you give ECT in isolation, people may relapse. But if you give ECT along with all these things, then people relapsing, the chances that people relapse will come down.
Right. So like you're indicating, we don't have any major evidence as such that it has very long-lasting effects, and
it might have, but we don't have evidence to say that is
correct. Yeah. Amidst all this, sir, we've spoke about the technicalities of ECT, the indications, contraindications, how do we give ECT in special populations, and how ECT has evolved over time. Can you just go back in your vast experience, any remarkable case that you can think of where ECT made a significant difference? If you could share that with us, sir.
Good that you asked this question. I have a 72-year-old person in mind. Okay. He was a high achiever. He was a finance person from India, but he had been very successful in his business in the Gulf countries. Unfortunately, at the age of around 70, he started having severe depression. He was actually having very good business there, but because of depression, he started, becoming less and less efficient. He was treated with medicines, antidepressants, psychotherapy, etc. Did not improve to the extent that he had to give up all his business and come back to India, which caused a huge financial loss for him. And in India, he was seen by many psychiatrists. Many people did diagnose him as having depression with psychotic symptoms. For some strange reasons, they did not offer him ECTs. So they started giving him various kinds of medicines. Some medicines had so much side effect that he had an intestinal obstruction. Okay. He nearly died, and immediately had to be operated, and he survived. Then he had some cardiac issues, and he had he had aspiration, which caused pneumonia. All because he was so depressed that he was not able to take care of his physical condition. He came to our hospital, NIMHANS. Our colleagues from geriatric psychiatry, they offered him ECT. The family said no ECT. So went back. Another 6 months they struggled, and he didn't improve. And then they brought him saying that, okay, you give ECT now. Within 3-4 ECTs, the person became better. He started smiling. He started talking about his business back. He started, becoming more positive. Had he received ECTs about 2 years before in the Gulf country itself, he would have been still there. He would have been a successful entrepreneur and businessman, and he would have had a good health. nearly 2 years, they did not give him ECT. That caused so much of medical complications. They nearly he lost him. I didn't know why people hesitated so much to give him ECT. It is a indication that is written in textbooks, that is written in many medical guidelines, that elderly people with severe depression and psychotic symptoms, ECT can be a life-saving treatment. So that case actually is very, raw in my mind.
Yeah, and very beautifully you told how an elderly man, such a high functioning person, got depression, struggled for almost 2 years. Then finally they agreed to take ECT and he got better, back to his normal self. So good to hear that, sir. And I'm sure this will send a positive message to everybody who is listening to this.
Sure.
But I think one very important factor in people, their hesitation, the family that you mentioned now, they were not very willing, they went back. I think one very important factor in this is the role of media, how media portrays ECT. You did mention that in the beginning, but let's talk about that a little more, sir, because I remember the depiction of ECT in certain Bollywood movies that I have seen. In Hollywood, I'm hearing it's, like you said, barbaric. That's how they show it.
Yes.
The hair getting raised and person like experiencing that sort of a torture. How do you think that is playing a role in this perception, sir?
Yeah, I mean, movies are a religion in places like India and maybe elsewhere also. So they influence people's mindset a lot. They influence the society's mindset a lot. So unfortunately, ECT has been shown as a means of punishment, as a means of making people forget things deliberately to usurp somebody's wealth. His or her brother would take that person to a very unscrupulous psychiatrist, and who would be more than willing to give ECT in a most painful way, so that the person becomes mad or forgets things, and then that person can be dumped and the property can be usurped by the relatives. Many such movies are there, and that's what people see. They don't come to the hospital like ours and see watch ECT being given in such a very controlled and a humane fashion, with a lot of people, talking to them and consoling them and comforting them. The entire team comforting the people who go through ECT. What people see in the movies and what happens in real life are so different. Unfortunately, people don't show that in movies. I mean, that doesn't sell. So, unfortunately, that has influenced a lot of people's mindset. And it is also written. I mean, there is a lot of bad press also about. There are a bunch of people who call themselves as survivors of ECT and say that it has caused havoc in their life. I don't know. I don't want to kind of foo their experience. I don't know. I can't comment on that. But people that we have treated, we take their consent, take their family's consent. If the person is so sick that we cannot take his consent, we take the family's consent. The moment the person becomes capable of giving consent, we take his consent also. We never force ECTs to anybody. So that is the kind of human practice we do. Unfortunately, media doesn't show that.
How do you think media, how a responsible media person or how a responsible movie maker should portray ECT like, sir?
Like we do in places like NIMHANS.
As easy.
So, right. Thing like that,
The authentic way.
Yes.
Like how do you...
I mean, I think if they talk to an authentic ECT practitioners, they will get the correct information and they can...
Right. No, that's very important that you mentioned that, sir. Just moving ahead in time slightly, sir. Nowadays, we are hearing about a lot of other brain stimulation techniques. There's this RTMS, TDCS.
Yes.
Where do you think ECT stands in front of these?
Harkishan, I think we are comparing oranges to apples here. Right. The commonality is that they are all brain stimulation techniques,
Right.
but they are vastly different treatment modalities. Look, I mean, ECT, the electricity may be the source of causing seizures, but it is the seizure that is the treatment. It is not the electricity that is the treatment. It is the seizure that is the treatment.
Right.
So you produce seizures either through electricity or naturally, or even these days use magnetic pulses
Yeah.
to induce seizure. It works. So I mean, seizure is the key element. So these brain stimulation techniques have their role in people who are hard to treat and who are not suitable sometimes for ECT because of medical complications, etc. They may be offered the alternative brain stimulation techniques like TMS and TDCS, but they are not as useful as ECT in so many conditions that I told. They are not useful in catatonia, aggression, high suicidality, and like ultra treatment resistant cases, etc. And I think they have their roles and ECT has its roles. I don't see them as kind of competitors to each other. No, it is like, if you ask me which is better, psychotherapy or ECT, I think it has its role and ECT has its role. It's like that.
Correct. Yeah. Rightly said, sir. I mean, do you think that there is any treatment that might take the place of ECT in the future?
It may. I mean, I wish something like that comes, but not because ECT is bad, but because it is a bit of cumbersome. So it is given in only some places. People, and as I said, in most people, its effect is temporary. They may have to come again and again. For some patients, it's required many times. It takes nearly half a day of the person's life off for so many days. So given all these things, and it requires anesthesia, it requires a setup like that. If something comes which can take care of these logistic issues away, then why not? I mean, I will highly welcome such a treatment to show up.
Yeah. When you say that, I can think of ketamine as a thing which is, of course, not as comprehensive as ECT, but in some ways, I think that is also doing some good to a lot of patients with treatment-resistant depression, at least.
Correct, it does. I mean, again, like for depression, particularly those with suicidality, ketamine seems to be as good as ECT. Maybe ECT is better, but there are some indications that ketamine has its very strong role in such patients. But it doesn't work in other conditions like catatonia or mania, aggression. ECT has many indications. Ketamine has severe depression with suicidality as an important indication.
Right. I mean, we've spoken at length about ECT, but something that always I'm wondering is that what can we as psychiatrists or let's say mental health advocates do so that the message for ECT is a positive one out in the community? What do you think a senior professional like you would suggest to people like us, sir?
I think I will give a very simple statement. When patients are chosen wisely for proper indications, ECT is a very good treatment with, I would say, overwhelmingly mild and temporary side effects. So that's my message, I would say.
Yeah, in just one sentence, you try to summarize that, which I think is a very important one. It is effective, and at the same time, like you said, there are no major side effects as such.
Right.
It's been a wonderful discussion. I did not realize where the time flew, sir. But if there's one message that you would want to give to, let's say, an Indian family who is deciding and like who's watching this podcast when they come across in their Google search and they have to take a decision whether their psychiatrist has just advised them ECT and now they are trying to make that call whether they should be giving ECT, electroconvulsive therapy or not. What is it that you would want to tell them, sir?
I think the best person to talk will be their psychiatrist and not me.
Right.
So, but having said that, we should know that if a psychiatrist has advised, it is likely that it is very useful for that person. There may be some temporary side effects, and they are mostly mild, and as I said, after some time the person becomes better. They should not have any apprehensions about it being painful, it being dangerous, it being the last resort. And many people may think that it damages the brain. There is no evidence to say that it damages brain at all. So please don't have these kind of apprehensions. Discuss with your doctor. You can ask, are there alternatives? And if there are alternatives, the person may say that the professional would say. But if he says that this looks like the best, then you need not have apprehensions about ECT.
Right. That's a very important message that I think you gave to our viewers, and I'm sure a lot of viewers will get benefited from this entire video. Thank you so much for taking out time from your schedule, sir. It almost took me back to my NIMHANS days where you used to give us talks and used to be engrossed. And it is really, again, a moment of pride to have my teacher sitting next to me on this podcast. Thank you so much for making time, sir.
My pleasure, Harkishan. Anytime.
Thank you, sir. Thank you, sir.